Is Social Security and social services and all the rest of it. Here are some things that if I was elected enlightened dictator of the day, here's what I would change. So my name is Ed Weir. I ran the third busiest office in the country. And in my semi-retirement, I've done over 400 videos on all things Social Security, retirement, disability, Medicare, Medicaid. I do a live, and actually, this is a live recording right now. So I'm going to talk about the things I would definitely change if I had the power. And after that, I'm going to open it up to any of your questions. There's so many people out there, tens of millions, hundreds of millions of dollars, unclaimed benefits just sitting around because people don't know how to navigate the system. So this is my mission in my semi-retirement to do that. All right, so let's get started here. Let me pull this up. Is definitely, if you're watching this as a recording, make sure you subscribe, and that way if you do have any questions, you, your family or friends have questions in the future, you can find us again. The first thing I would do is to get you all some more money, is change the COLA, how COLA is calculated. Right now, COLA is calculated based on the CPIW, which is a consumer price index. So it's a basket of goods that who would buy. The people, this particular one that the Social Security uses to get your COLA every year. So this year is what, 3.2%. Last year was over 8%. And this is how they calculate that on a basket of goods for urban wage earners and clerical workers. But I talked to talking to a few million people on retirement, and yeah, they don't fit within those categories. The CPI, the Consumer Price Index, the basket of goods, if I was enlightened dictator for a day, the first thing I would change is okay, yeah, you're going to stop using that CPIW and use the CPIE. It's kind of an elderly, for 62 and older, because it's weighted more towards health care. And then, once you hit 62, more of your money goes to healthcare. And as you hit your 70s, 80s, even more goes to healthcare. So right now, that's not taken into consideration. And that's why the COLA is, I believe, and even the statisticians would argue that if it was based on CPIE, you would have about a 2% extra every year. So this year, we would have got a COLA of 5%. Last year, we would have got a COLA of 10%, over 10%. So, and that over a decade or 2 decades, that definitely, definitely put some money in your pocket. I'm not going to talk about if I was a enlightened dictator again, this is how I'd save Social Security. I've talked about how, in my humble opinion, I would strengthen Social Security and Medicare. I've talked about that in other videos, so I'm not going to talk about that today. Another thing I would do is I would just make the policy easier. Social Security policy, it's called POMS. It's over 20,000 pages. And that's the number one reason so many people are not getting the benefits they're entitled to. They're losing money. And that's why I'm doing these live Q&As. That's why I'm doing hundreds of videos to try to get the information out there. And I'm going to use this. I'm going to stop here and say, I can do a billion videos, but it doesn't help anybody unless y'all share it, subscribe, like, and all that kind of stuff. So we teach this stupid YouTube algorithm, Google algorithm, that this is important stuff, that it needs to get out to people. That's how you get it out to people. Share it on Facebook with your friends and stuff like that. We find money for people every single day. Found millions of dollars already this year. Just a couple days ago, a YouTube comment, a lady found $400, independently entitled divorced spouse benefits, the divorce decree, thought they couldn't get it. There's just hundreds of reasons people are not receiving their benefits. And so that's my job in my semi-retirement, to bring that to your attention. So make the policy easier. But each one of the policies, the 20,000 pages, the exceptions, and a lot of those exceptions are, once you think about it, and particularly when it comes to your particular case, you're like, oh, I'm glad there's an exception for there. So it's probably going to be difficult to make the policy easier and maybe more understandable, but to reduce the policy from 20,000 to 10,000 pages probably won't be practical. So on the flip side of that, more staffing to teach people about what they're entitled to. Right now, Social Security is at a 27-year low in terms of staffing. I retired a couple of years ago, and about a week after I retired, I got a letter and says, my old boss contacted me and said, you want to come back? And I'm like, no, I've already gone on with my life. So yeah, they've let too many people go recently, and now the staffing. But the problem with that is, um, if I was a light and dictator for today, and I would immediately say, okay, Social Security, hire, 20,000 employees, 10,000 employees, 30,000 employees. Nothing would happen for about a year or so. You could hire all those people, but they need to be trained. It takes about 3 months in every single day, 40 hours a week to train people on these 20,000 pages. And they have to go under full review for about a year. So anything they do, a technical expert reviews what they do to make sure they don't make any mistakes. And you're saying it doesn't sound like they do at my office, but yeah, that's the problem. They're putting people that are not fully trained up at the windows, and they're making lots of mistakes. Every single week, someone contacts me and say, hey, Ed, you told me to go in there and ask for that benefit. I went in there and asked for that benefit, and the person said there is no such thing like that. And I'm like, oh my gosh, it's new person just hired off the street. So I have to send people a reference number. Okay, go in there and say RS000202.001. And then you'll get and they go in there and give that reference number, and they get their money. So yeah, that's frustrating. Another thing I would do, Social Security, Medicare, when you go to sign up for Medicare, you go to Social Security. And a big thing now, if I was a light and dictator for a day, I always have to, in all my videos, anytime I say this, I always say, well, the number one thing I'm going to do is I'm going to cure male pattern baldness. And then after that, I'll do this other stuff. So sorry, being selfish, I have my priorities. So the other thing I would do, original Medicare. Original Medicare should have dental, vision, and hearing. Right now, original Medicare doesn't. So if you just have A and B, no vision, dental, or hearing. There is some, glaucoma, stuff like that. But yeah, the traditional dental, vision, hearing, it doesn't exist. So you'll have to go out there and get a separate dental, vision, hearing plan, either separately or through a Medicare Advantage plan. But I would immediately make original Medicare include those, because how healthy are you in retirement if you can't see, hear, or eat? So yeah, that would definitely one thing. And speaking of those plans, if I was an enlightened dictator for a day, I would say original Medicare alone. So the reason people have to get those other plans, Medicare Supplement, a Plan G, or a Plan N, or a Medicare Advantage, is because there's 6 gaps of original Medicare. So for instance, Part A, the biggest one is if you go into a hospital, you have to pay a deductible, $1,632. If you have the surgery in the hospital and it's $100,000, you have to pay 20% of that. There's a 20% copay. So you'll have to $20,000 out of your pocket. And I understand there's a funding issue. Part B, would have to increase the Part B premium or whatever the case may be. But I believe, the original Medicare was paid by your FICA taxes for decades. And to then, when you actually need it, so, okay, yeah, you paid all that money for FICA for decades, but you also have to pay this deductible and this co-insurance and these co-payments, and but you can go out there and get a private company. So if original Medicare covered that, it would be kind of like a Medicare Supplement Plan G, where it covered everybody. But a Plan G right now, average across the country is about $100, because the economies of scale. You've got, if you had one company that had everybody in the country under the Medicare Supplement Plan G that was eligible, then they could reduce their rates considerably. It might be like $20 a month, $30 a month, because everybody's in that one pool. But the reason it's $100 because they got to make a profit, and they don't have that many people. The more people they can bring in, the cheaper, theoretically, they can make it. So if original Medicare brought that in, then maybe your Part B would be $200, but you wouldn't need anything else, and you wouldn't have prior authorization with Medicare Advantage. You wouldn't have networks, so that's there's details obviously, and y'all can comment on and and say if you were a dictator for a day, what would you change, and all the rest of it. So, but these are my personal opinions. Another thing, and speaking of Medicare, right now, if you're on disability, if you're approved for Social Security disability, for some crazy reason, you don't get Medicare for the first 2 years. And people on disability kind of sort of need, health care because they're on disability. So I would definitely as soon as you're approved for disability, you're also approved for Medicare. All right. So I don't want to drone on forever. I kept it to about 11 minutes. And those are the things I would definitely change. And make sure you comment down below on the things you would change. I know there's a lot of people that policy and all the rest of it. Oh, one more thing. I always like to throw some extras in there. IRMA, the income related monthly adjusted amount. This is a higher premium Part B that people pay that are considered high income earners. So if you made, if you're single, if you made over $103,000 2 years ago, you're going to pay extra for your Part B. But the thing is, a lot of people get hit with that because they sell their house when they, get in their 60s. They've raised their family and they want to downsize their house, so they sell their house, and then all of a sudden 2 years later they get charged all this extra money for Part B, and it's like, well, no, this is a one time I sold my house. But for some reason, Congress didn't make that exception. So I would make that exception. If you sell your house, that's a special life changing event, and it shouldn't count to an extra IRMA. So there's my last one on that. Okay, let's see. And happy Father's Day out there to everybody, all the fathers. So hopefully we can find y'all some money. All right, let's see here. Let's go through the question. Thank you for doing this channel. Please tell me the best way to get an appointment with one of your reps. All right, yeah. So I've put together a team of reps that work the entire country because I was tired of seeing Medicare insurance agents, brokers doing the wrong thing and giving out the wrong information. So I said, just forget it. I'll do it myself. So if you need help enrolling in the Medicare supplement, Medicare Advantage, and I just put together an Affordable Care Act Marketplace Obamacare team as well. So if you need any help with all that, just let me know. Just email me at that number, call me, leave a message, and I'll have someone reach out to you. It's completely 100% free. And full disclosure, if you like their what they offer, and if you want to go ahead and roll in the plan that they recommend, then they support our channel, all this free service. Okay, let's see here. My husband is on SSDI and they made a huge mistake on his check, paying him a lot less. How long does it take them to fix something like that? They said it would take 60 days to respond. Is that true? Yeah, yeah. The 60 days is a kind of a pat answer. That's how long they just say for anything, whether it takes 2 days or 3 months. They say 60 days, 30 days, or something. So yeah, it really depends on the nature of the underpayment, exactly why they underpaid him. Probably SSI was involved, where they need to check. So you were approved for SSDI, and they just need to go to see if any SSI monies were given out. And if there wasn't, then it's pretty quick. If there was, then they have to do calculation of offset and everything like that. So, yeah, if 60 days, call them up and say, yeah, I understand y'all are understaffed, yada, 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 but we really need the money, and they should be able to expedite it. I really hope enough people in Congress are willing to increase the income limit that is taxed for FICA. That is the most obvious solution and the most fair, and ultra wealthy still have plenty. Yeah, they did that for Medicare. People on, that make, $1 billion. Yeah, they pay the full boat for Medicare. There's no limit on Medicare. They actually pay a little bit extra. So that doesn't seem to be an issue. But one of the problems is, the whole capital gains, they have all this money, but it's not realized money. And so they go to a bank and they use that as collateral, and then they get a loan, for like 1% interest because they've got all the collateral. So they just use that money and pay it back. So they just pay 1% interest versus 20%, 30%, 40% taxes. And because that's a loan and they're not really getting any income, they don't pay. And so, yeah, so that entire system, I agree, needs to be fixed by someone that's smarter in that particular financial field than I am. Thank you for all your help in burial final cost insurance. Much appreciated. Yeah, you're welcome. Yeah, and my team also does that as well. Why do I also do the burial insurance? Is because I have taken hundreds of thousands of survivor claims, and survivors walked into the office, at a terrible time, and get them in their survivor benefits, and I give them that lump sum death payment, the $255, and they look at me like I'm a fool. And what am I going to do with this? The funeral costs $10,000. So that's why I say you got to get burial insurance. If you don't have that kind of money sitting around, for the burial, to pay off any medical debts, credit card debts, home or anything like that. Well, I had one guy use it, and he was good, but he got a $10,000 burial because you can use it any way you want. And the deal was, when he passed away, his family had to use that money to go to Hawaii. So yeah, so it's like, yeah, I'm no longer here, but y'all go have fun. So I thought that was an interesting thing. So I'm collecting my Social Security, but I'm still working. If I continue working after September 1, will I will have gone over the allowed 22,000. Yeah, so if you go over any Social Security will hold back $1 for every $2 you go over. So if sounds like it's not your first year, there's different regulations for the first year. But if you're going over the $22,320, what will happen is because Social Security won't know it immediately. When you file your taxes next year, in March, April, or whatever, you file your taxes, the IRS notifies Social Security. The Social Security looks at it and says, hey, this person was receiving Social Security early retirement, and they went $2,000 over. So they will send you a bill for $1,000 and say, pay us. If I notify Social Security to stop my checks now, what happens if I lose my job in September? Yeah, so you just call them up and say, hey, I'm going to go over this year, and you go ahead and stop your checks. But if you're uncertain, then what some people do is, because they don't know but they need the checks, but they don't know if they're going to have a job, and it's kind of in flux. What some people do is they just keep the checks and then put in the bank. Put some of it in the bank, or what they think might be the overpayment. And that way, when they get that $1,000 bill in April or May, they just go ahead and pay it off, and there's no sweat. People always, oh my gosh, they're going to have my number, and I'm going to be in debt to the government. Social Security employees have way too much to worry about. Then yeah, don't. If you've got an overpayment, set up a payment plan, pay it off. It's nothing personal. They're are you going to be red flagged? No, you're not going to be red flagged. Yeah, there's nothing like that. Just go in there, send them the check. Hello. I won't ask any stupid questions tonight. You never ask any stupid questions, Zippy. Yeah, all the questions are good. Mario, I'm turning 64 in August. Should I file after my birthday? Yeah, your birthday doesn't really matter. Yeah, people always wonder, should I file before or after my birthday? Or, do I get the extra COLA during my birthday, or is the extra increase at my birthday, or do I have to wait the full year? No, every month you file your benefits early, your benefits are reduced a little bit, whether it's around your birthday or the other 11 months of the year. Your birthday really not relevant. The only time it's really relevant is if you're going to file at 62, you have to be 62 the entire month. So if November 15th is your birthday and you're 62 November 15th, you can't start your benefits until the next month, December, and then you'll get your December check in January. So yeah, the birthday is not relevant. You can file anytime around there. Will they reinstate my benefits since I won't have exceeded the allowed? Yeah, so I just think I just answered that one. Yeah, just if you're kind of in flux. How long it's take to get replacement for Social Security from outside the US? Yeah, mailing and all that kind of stuff. It really depends what part of the world you're at. I currently draw Social Security based on divorced spousal benefits. Oh, on the Social Security card, if you do it in country, it takes 10 days to 2 weeks to get it. So just take that into consideration, however, where you are in the country in terms of extra mailing. I currently draw Social Security based on divorced spouse benefits. I am 73. If I remarry and later die, can my new spouse draw my current Social Security that is the ex-spouse divorced spouse? No, they can't. They can't collect from your ex-spouse. Donna, yes. Can I claim SSI if my husband works? I receive $790 a month. So SSI is the welfare-based program. So you've got $790 there. So the max you would be able to get is up to $943. So an extra $100 or so. But your husband works. So SSI, the welfare-based program, no. My husband gives me $250 a month for me and food. The rest, yeah. So the SSI is a welfare-based program. Together we made, $65,000. Yeah, so you definitely cannot get welfare if you make that kind of money. If applying for deceased ex-spouse benefits over 60 but before FRA, and your own FRA benefit will be more than ex-spouse benefit, do they make you take yours early? Deceased, no. For if the person is living and you're filing for living spouse benefits, current spouse or divorced spouse, then they make you file for benefits on your own record. But surviving spouse benefits, they do not. So again, that's a strategy I always talk about. File for surviving spouse benefits, widow benefits, it's all the same thing. And then start that money and don't touch yours and let yours increase until it's to a nice level and then switch over. My husband and I divorced after 23 years. I haven't remarried. Can I draw his Social Security? Yes. If you're 62 years old and your ex has reached 62 as well and you're not remarried, then absolutely. There's another way. Tens of millions of dollars are being lost every year because it's called independently entitled divorced spouse. And your ex-spouse doesn't have to have started their benefits yet. So that's where tens of millions of dollars are being lost every year. You got people out there walking around that says, well, I really need that extra money from my ex-spouse, but he or she hasn't filed yet, so I have to wait till they file. No, you don't. Yeah, you do not. But so many people don't know about it. Social Security employees don't know about it. And this is one of the ones I talked about, that you go into a Social Security office. The problem with Social Security offices, again, I ran the third busiest one in the country, so I'm telling this from the facts, is that the people that work at the front window, when you go to the front window without an appointment, those are customer service representatives, and they're kind of jack of all trades, master of none. Hardest working, lowest paid, but yeah, they are not the experts in SSI or SSDI or retirement and survivor benefits. So quite often, particularly nowadays, quite often they're giving out wrong information. And those people, there is no such thing as independently entitled divorced spouse. Your ex-spouse has to start receiving benefits before you get it. And those people walk out of the office and they've lost tens of thousands, hundreds of thousands of dollars worth of benefits. Yeah. And so once the staffing is improved and the information is given out there, then I can go back into retirement. But I don't see that any time in the next couple of years. I'll be here for at least another couple of years or so. Then I helped people file for disability after I retired. Was shocked when I called the 800. Okay. Let's see here. Questions. How long does someone need to wait for a final decision on an overpayment waiver? Yeah, it takes a while. Hopefully, in the meantime, you've taken advantage of the new regulation where they can expand it to 60 months. So a couple of months ago, they changed the regulation. It makes it very, very easy to do the repayment in 60 months. So you're like, well, I don't want to pay anything. Well, if they're making you pay right now, do it for 60 months. And then later on, when they do the waiver, which can take a month or 2 months, unfortunately, and if they determine at that time they're going to waive it completely, they'll give you all that money back. So Where do I find burial insurance? Yeah, just call, leave a message, tell me your name, phone number, your state, because they're all state specific, and say, hey, I'm looking for burial insurance quotes, or email me. On the homepage, you see my phone number and email and everything, and then I'll have someone that's licensed in your state um, give you a quote. Let's see. Laura, is it true that if I did not go through the 11th grade, my disability might have more of a chance for approval since 2024? I also have not worked jobs. Yeah, that's education. They check on education, because the more education you have, the more job opportunities you have available to you. So when they check to see if you're disabled, unable to work, they say, okay, well, this person has an advanced degree, and so they should be able to get jobs doing something. But yeah, the less education, the more difficult it is for you to get a job, and therefore, if you're disabled as well, then yeah, that is something they definitely take into consideration. I hope I haven't made an ignorant blunder or is correctable. The SSA said that after remarrying, I cannot switch from claiming on my own record to claiming on my ex-spouse record. Yeah, well, you always have to collect on your own because that person is still alive. Um, and then the difference of the two. So if you're eligible for $1,000 from a spouse or an ex-spouse, okay, and your own benefits are $400, then you can get $600 from that person. But you always have to collect your own first because that person is still alive and kicking. The only case that is not correct is survivor benefits. Hi, I requested and received an IRMA exception to 2023 income. I discovered I went over IRMA by 2 or 3,000. They have not contacted me yet. This IRMA will affect 3 years. How do I correct this? No, it only affect, well, if you did that for 3 years, then it'll affect 3 years. But if it was only 1 year, it'll only affect that 1 year. So in 2022, you went over, then for 2024, you're going to pay the extra IRMA for the rest of the year. And then January, they will look at 2023. So if 2023 is good, then you're good for 2025. It's only for 1 year, and they look at it every year. So yeah, you can do a life-changing event. It's SSA 44. It sounds like Kate did that and says, yes, I made, over $103,000 at that particular time, but I have since, lost that job. I retired from that job. I got divorced or whatever the case may be. If you have a life-changing event, then you can get that changed. And unfortunately, the life-changing event does not include sale of a house. Yeah, I mean, you can appeal the sale of a house all day long, but yeah, they'll deny it. And you say, well, I used the money to buy a new house. Yeah, that's unfortunately. That's why if I was a dictator today, I would change that. Why isn't this process made to be less confusing to the first timers? Is this designed this way on purpose? No, I think it's just not on purpose. I don't think the government does anything on purpose necessarily. Well, anyway, sometimes they do. But yeah, it's just lawyer or politicians and their donors and their constituents saying, well, this should be making an exception. The ex-spouse should be able to collect benefits, and the surviving spouse, shouldn't have to collect on their. Yeah, it's just, if you look at each one of the laws, you can make a argument that they're good, for children and deceased and widows, but the program's been around since 1935, and I mean, if you go to buy a car, see the kind of contracts you have to get, signed to buy a car. It's longer than 10 times longer than the U.S. Constitution. So yeah. Like, subscribe, everyone. Yes, please. That's how we get this information out there. And by liking and subscribing, you probably will have found money. That's how that person found the $400 a few days ago, is because someone, Linda or Naeem Muhammad or whoever, pushed that button, and that taught YouTube to give it to more people. Okay. Received widow's benefits 2016 was 66, received a letter from Social Security 3 months before 70, removed from what have benefits that I received more SSA up on 8%. District says, yes, good. Yes, good, Cheryl. Yes, this is, there is a WIB-RIB workload in offices throughout the country. And it's people that are on widows benefits that are just collecting widows benefits, and they're approaching 70, and their benefits on their own record are more. So their Social Security sends out these letters, and they actually, we had someone, who was it, Irma? Yeah, in our office. Hi, Irma. That had to go out there and send out the letter, not go out, but send out the letters and contact people and say, hey, you've been receiving widows benefits for a number of years, and we just want to remind you that your benefits have increased up to 70, the delayed retirement credit, so you get 8% per year. But the problem is, a lot of people don't respond to that. They have moved and they didn't update their address, or they don't pick up the phone, or they don't get the mail. And so there's a lot of people out there that are 70 years old or older, 70s, 80s, 90s, and they've been receiving widows benefits, but they could have switched to their own record and received a lot more. So there's another tens of millions, hundreds of millions of dollars being lost out there because people didn't get contacted like Cheryl did. And she picked up the phone and actually took the claim and had to do her part, and she got that extra money. So that is a beautiful thing. We just need to do that a whole lot more. Naeem, 64, April, SSDI in 2012, 90% disabled vet retiring to Thailand. October 20th, can I keep SSDI? Yeah, you can keep SS. Well, no. You can keep your SSDI, Social Security Disability Insurance, stops automatically once you hit your full retirement age. And the check is still the same and everything. It's just a bureaucratic thing. Your Social Security disability benefits switch to regular retirement benefits. So you'll never know the difference. You'll still get it in the same bank account, same amount, everything. But no more CDRs, no more work limitations. And yeah, if you're a US citizen or a green card holder, and then yeah, you can live anywhere in the country. There's a, if you're not a US citizen, there's limitations, and if you can get your checks overseas, go to SSA.gov, or just type in payments abroad screening tool. And it's a great little screening tool that Social Security has, and you can go through there and find out whether you can get your benefits overseas. And you can't get them in Korea or North Korea or Cuba. So if you planned on enjoying the beaches in North Korea, sorry. Thanks. Happy Father's Day. Thank you. Appreciate it. I actually got calls from my kids today, so it's a beautiful thing. All right. I will turn 65 in the year of January 2023, 2025, and I understand that I will be eligible for a different kind of Medicare plan than Advantage plan. Can you explain? No, well, yeah, everybody, once you turn 65, you can, so you have to have original Medicare Part A, Part B, and then you have to figure out how you're going to cover the gaps, all those 6 gaps, the 20% and the deductibles and the copays. And if I'm not enlightened dictator by that time, you have 2 options: Medicare Advantage plan or a Medicare Supplement plan, also called a Medigap plan. So they're both offered by private companies, and they both have their pluses and minuses. I recommend Medicare Supplement plans, a Plan N, then super close behind a Plan G, and then Medicare Advantage. But I just did a video yesterday on the particular situations I would not choose a Medicare Supplement. One of those if you're receiving Medicare and Medicaid, or if you're receiving TRICARE for life. But yeah, watch that video. So those are your 2 options. So check them out. I've done a bunch of videos. If you want someone to go through your options with you personally and tell you what's available in your area and how much and all that kind of good stuff, then call me, leave your name, all that kind of good stuff, or email me, and I can have someone reach out to you and give you all your options, and completely free, of course. If I get a full-time job, can I suspend my Social Security? Yeah, if you're in early retirement, then you just call Social Security and say, hey, I'm going to make way over, and they don't want to overpay you, so they will hold back $1 for every $2 you say you're going to go over. So if you say you're going to make $100,000, then probably stop all your checks. I get $764 Social Security, but work, not making over the allowed 20. Can I apply for SSI? Yeah, the most you can get on SSI, the welfare-based program, is was it $943 this year? And yeah, so you could get another $200, but you work, and that will offset that. So just by those numbers alone, no. And you'd have to be disabled. SSI, if you're not 65 or older, then in order to get SSI, you have to be disabled. Take a took. Okay. I am disabled and having an advantage program, but under 65. I'll be 65 in July. Will I still have to go underwriting for? No. Yes. There we go. There's someone that sounds like she's prepared there. Yes, you're in your golden opportunity. A lot of states, they don't mandate the companies to give Medicare supplements plan to people under 65. So that's probably the situation in your state. And so you had to do a Medicare Advantage, and with the pre-authorizations and the networks and all that kind of good stuff. So yeah, once you hit 65, you're just like everybody else that hit 65. They don't, you know, no medical underwriting. They can't ask you about your disabilities or anything like that. They just ask you what your age is, do you smoke, and that's, where you live. And yeah, and go over your options. Again, email me and I'll have someone go over your options if you don't have a broker. Again, there's agents and there's brokers. So a traditional, like a captive agent, they work for one company. So when you call them up, guess what option you're going to get? You're going to get their company. I only deal with brokers. Brokers work for you. They are licensed and contracted with several different companies in your area, and they look at the companies in your area and they say, okay, based on your needs and your health and your doctors or prescriptions or yada yada yada, whatever in your particular case, these are the best ones in your area. 1, 2, 3. What do you think? So let's see. Happy Father's Day. Thank you. Happy Father's Day to everybody out there. The COLA is usually a bit higher in some areas for current employees like Hawaii, Alaska. Would the CPI formula you mentioned address the discrepancy area? Yes. Yes. Yeah. So it's the same basic CPI formula where they take it of the third quarter of the previous year, compared it with the third quarter of this year. And that's one of the reasons why, all this clickbait out there, the COLA for next year, nobody knows what the COLA for next year is until September 30th, until the Department of Labor Statistics comes out with the numbers for the third quarter. So everything that says you're going to get extra money and this, that, and COLA and stuff like that, based on what the COLA is today, the consumer price index today is going to be, well, it doesn't matter what the consumer price index today is. No relevance whatsoever. Anthony, my wife retired at 62 6 years ago, and I retired at 64 this year. Can my wife get part of my Social Security added to her check? She draws a lot less than mine. Yeah, if her benefit amount is less than half of yours, then absolutely. So, and I retired at 6. So, if you've already filed your application, then she can start hers as a spouse, but you have to start your benefits first. And usually what happens is, you call and schedule an appointment and take your claim over the phone. And then as soon as you're done, you hand the phone to your wife and your wife does the spouse claim. And there's another way people are losing tens of millions of dollars out there is they look at the wrong numbers. So, for living spouse, your benefit amount has to be less than half of your spouse's, current spouse or divorced spouse. And what happens is they look at their checks and they say, okay, I got $700 and you got $1,400. And so I guess that's not less than half, it's exactly half. And so I guess no more money there. But no, they don't look at your check amount. That's what Social Security called, well, no longer so what Social Security and I used to call, it's called the MBA, monthly benefit amount. That is not your PIA. Your PIA is your benefit at your full retirement age. So one of those, the $700 might be the early retirement, and her full benefit amount is higher, or this one is higher. So just don't look at the checks. You have to call up and say, and there's also, taken out for Medicare. So tens of millions of dollars being lost out there because people are looking at the wrong numbers and they're not getting those spouse benefits. So, all right. Goal to get at least find $100 million for people out there this year. I think we're definitely on our way. I am divorced and went on a lifetime benefit, not 1 year, $100 million 1 year, but lifetime benefits. I think we can definitely get, hundreds of millions of dollars found for people. I am divorced and went on to earn more than my ex. I understand that he can choose to draw on my not SSI. SSI is the welfare-based benefits, but you mean Social Security benefits, okay? Instead of his record. No. No, he has to file for benefits on his own record unless you are deceased. And I take it by you are typing, you are not deceased. So yes, for living spouses, he has to file for benefits on his own and then spouse benefits on your record if his is less than half of yours. Lisa, I was born in 1960 when COVID hit and so many were unemployed. ARP ran an article saying people born in 1960 could take a bad hit on the calculation of their. Don't see anything different necessarily. It's again, the COLAs. Yeah. Let's see. I'm on SSDI. If I took my pension, will they stop my SSDI? Nope. Nope. Pension doesn't affect SSDI. SSI, the welfare-based program, yes, it does. But SSDI, yep, pension. If your pension comes from a non-covered work, so that means you work for a state, local, city government that did not pay into Social Security, then it might. But if you didn't, work for, government, local government like that, then no problem. I am drawing disability. When I turn 65, can I draw my ex-spouse's Social Security? Yeah, you can draw now. If you're there's another thing that hundreds of millions of dollars being lost. People on disability think the spouse and the survivor rules don't apply to them because they're receiving disability. No, if you are receiving disability and you're 62 years old and you have a spouse that's receiving retirement benefits and theirs is more than half of yours, then you can collect spouse benefits. But the problem is people go into the Social Security Administration and they tell them that and they say, well, your disability is going to stop. No, it's not. It's just going to be added to. Oh, your Medicare is going to stop. No, your disability still continues. So it's just you're going to get more money as a spouse or ex-spouse or a surviving spouse. And it's called a dual entitlement. And I have a reference number for that one too. So when you go into Social Security and they tell you incorrect information, you can pull out that reference and say, here. If my husband, God willing, would I lose his Social Security? He is getting Social Security now. So if your husband passes, would I lose his Social Security? No. If you're receiving spouse benefits, current spouse benefits, or even divorced spouse benefits, and that person passes, your benefit amount will actually increase because spouse benefits are up to 50%. Surviving spouse benefits are up to 100%. You'll get basically what he was receiving, depending on some different variables, but your check will increase. And that's why I got a YouTube comment a couple of days ago and says, how do I know, and how do they put it? How will I know when my ex croaks? So I guess they're looking for that extra survivor benefit. There's another reason people are losing hundreds of millions of dollars is they go into Social Security at 62, 63, and they file for benefits on their own record. And they say, hey, I was married for, at least 10 years to this person. And can I get benefits on that record? And the Social Security employee says, no, you can't get benefits on that record. And so they think they can't get benefits on their record because that's what the person just told them. But the Social Security employees need to do a better job out there. If you're listening, don't put it like that. If the situation is you're not entitled to benefits on their record because your benefit amount is over half their amount, right? Over 50%. So there's no more money there now while he or she is alive. But if that person passes, then there's a lot of money available there. So, but they don't tell them that other part. And there's tens, hundreds of thousands of people walking around out there that have money that are just sitting on the table And because they were told, oh yeah, no, I'm not entitled to benefits. Yeah, you're not entitled at that particular time, 10, 20, 30 years ago, but that person has since passed. And now you just might be eligible for those benefits. So please, let's get the word out there. Can I file an appeal in the time? Yeah, you can file appeal for everything. What if the ex-military spouse remarries? Can I claim the benefits? Ex-military spouse, yeah, it has nothing to do with military. Are you talking about Social Security or VA? Yeah, I'm eventually, once this channel gets bigger and all that, I want to bring in a VA person. I'm former Marine Corps sergeant, but I never worked at the VA, so I need to bring it. So yeah, if you're just talking about Social Security, an ex-spouse, if you were married to that person for 10 years or longer, um, and you're 62 and they're at least 62, yes, you can file for benefits on their record. What if a state agency owes an overpayment for money due to Social Security that was received over 2 years ago? Yeah, then the state agency should pay it back. Is it smart to begin receiving Social Security as soon as I'm fully eligible? I plan to retire. Yeah, there is no pat answer for that. It's your particular situation. I did a video on that. I would never take it at 65. It was kind of a reaction video. And so if you need the money and you're not working, not going over the annual earnings limit, get that money while the getting's good. If you're healthy and you don't necessarily need the money and you want to increase your benefit amount, wait till your full retirement age. If you've got genes in your family that are really good longevity, then yeah, wait till 70, get those delayed retirement credits. And people often say, well, the life expectancy is like 76 and 78. No, the life expectancy in America for y'all is not 76 or 78, because you are hearing the words coming out of my mouth. That is life expectancy on average for the entire country. If you're born in this country, your life expectancy in day one is 76 to 78. But if you've already made it this far, your life expectancy, I did a video on this about a week or so ago, your life expectancy is another 10, 15 years more than that, because you've made it this far. You made it to your 50s or 60s or so. So it's the mortality rate based on, so that if you go into Social Security .gov, SSA.gov, they have a mortality rate chart, and it says, okay, I was born this year, and it'll tell you, when the bean counters think you will shuffle off your mortal coil. Don't forget to like and thumbs up. Yes, please. Thanks for addressing my question. You are welcome. Peter, my wife passed away about 3 years ago. I collect Social Security disability. Will I ever be able to collect on my wife benefits, and will automatically be transferred my full retirement age? Yes and yes. So, Peter, there might be some more benefits. If you're at least 60 years old and you're not remarried, because you can collect survivor benefits at 60. There's another thing, people are losing millions of dollars. They think they have to wait till 62. No. So for survivor benefits, 60 years old. So if you're 60 years old, I would definitely call Social Security, the 800 number, and say, hey, how much are the survivor benefits? And because if you started at 60, it's going to be reduced. If the longer you wait, in most cases, the benefit will go up. So depends on how much your wife worked and how much her benefit amount is, her PIA, and how much your benefit amount, your PIA is, and they will be able to figure out. And don't let them tell you that if you file for survivor benefits, you will lose your disability, because that is not the case. Because, just because you're on disability, that means you lose survivor benefits, that you lose spouse benefits. That makes no sense. I understand the government makes no sense, but anyway. And in terms of, if you're just on regular disability, and so if you're receiving disability and survivor benefits, when you hit your full retirement age at 67, your disability benefits will just switch to retirement benefits. So you'll be receiving retirement benefits and survivor benefits. So it's called dual entitlement. You're entitled to two different things. In order to qualify for survivor benefits on ex-spouse, must I be claiming spousal benefits presently before express? No. That's no. it doesn't hurt. And that way, if you're not in touch with your ex-spouse, like that person says, how do I know if they croaked? Well, file a claim and get $1 from, if there's an extra dollar on there to get it. And that way, if that person does ever pass away, then you walk into the bank one day and your check is usually $1,200, and then all of a sudden it's $2,400, and you're like, oh, I guess they passed away. But no, you just have to. So if you're aware of that person, and they, as soon as you find out they pass away, immediately call Social Security and say, hey, I want to file for survivor benefits. Being disabled, I only could get the Advantage plan at now turning 65. Well, okay, yeah, I think I answered that one. Yes, definitely. If you can afford it, there, comes with a monthly premium. Again, if I was a dictator for a day, everybody that would be included. So the monthly premium, $20, and which include vision and dental in here. But anyway, yeah, I would say vote for me to be dictator, enlightened dictator. But I guess you don't really vote to be dictator. Well, I guess most dictators were voted into office. But anyway, we won't go there. What other kind of questions? I'm 63. Hub's retiring at 65. If I draw now, will that change the amount I get later? So yeah, this is what a lot of people do. I did a video. It's called the split strategy. So I assume you're the lower wage earner, so your earnings were lower throughout, so your benefit amount is lower. So that's what a lot of people do. They go ahead, and the lower earning spouse, starts those benefits, if you're not working and all that kind of stuff as well, or you're staying under the annual earnings limit. Get those benefits, and when your spouse files, the higher earning spouse, they file their retirement claim, and then you grab the phone and you file your spouse claim, and your benefit is brought up to 50% of theirs, depending if you wait till you're your full retirement age at that time, you get exactly 50% of their PIA. So yeah, that's what a lot of people do. They do that split strategy. Start your benefits now, and then it's like, but it's going to be reduced to 30%, way down low, but it's going to be increased up to 50% of theirs when they file. So it doesn't matter what you get now. When they file, it'll be brought up. So if you get 200, if you're entitled to 1,000 on theirs and you get 200 now, when they file, you get 7. If you get 300 now, 200, you get 800. Yes. And if you get 300 now, you get 7 for them. If you get 400 now, you get 600 for them. So, and the reverse is the case as well. If I downsize and buy another home, I pay taxes on number one. Okay, yeah, I don't do taxes. If a Canadian is married to an American and has a green card, does spouse get Medicare as well? Yeah, if an American citizen or a green card holder and you're entitled, yep, absolutely. Medicare is included in there. My ex-husband applied for disability. If approved, will I get percentage for past due court-ordered child support? You can definitely, you will, now that they're getting federal benefits. I think I just did a short video on this one. But yeah, if they're getting federal benefits and you had a hard time getting child support before because, where they worked, but now they're getting federal benefits. So go back to the court and tell them, hey, this person's getting federal benefits, and they will send a garnishment order to your local Social Security, or to that person, to your ex's local Social Security office, and their wages, their Social Security will be garnished. We used to do it every single day. Let's see here. I filed a form 521 since I went back to work this month, and they sent me a letter telling me how much to repay. I gave them a check, but it's still outstanding. How long did it take to cash it? Yeah, in my office, we had to process those checks the same exact day, and I had to go through the entire report every single day. So, but the local office sends it to the processing center, and so it about a week or 10 days, but it goes out of your local office pretty quickly. Thank you. So are you saying that if someone's work salary goes over $22,320, right? Let's see, is there a second part of that question? Okay, here we go. So you're saying that if someone's work amount is going over, the SSA will suspend, but if someone isn't working, they would have to pay back what they received. Um, oh, okay. I think I know what you're talking about. Yeah. So if you go over the annual earnings limit, Social Security will hold back $1 for every $2 you go over. There is a way. Other than that, the only way to kind of stop your benefits is within the first 12 months. You can withdraw your application within the first 12 months. You can get kind of a do-over and say, oh, no, I made a mistake, I shouldn't have filed. So you withdraw your application, but you have to pay all that money back because it's like you never filed an application, and you can only do that within the first 12 months. Is there an age that working to try to raise your Social Security monthly benefit doesn't make a difference? Nope. Nope. You can be 125 years old, and if it's one of your high 35 years of earnings, then nope. It will increase your benefits. There is no age where they don't continue to reevaluate to see if there's a high 35 years there. And that's all automatic. You don't have to do anything. Once you file your taxes, you notify the IRS, and the IRS notifies Social Security. Social Security looks at it and says, oh, here's last year was a high 35 years. So we'll kick out the low one, put in this new one, recalculate, and you get extra money. Linda, I am 77 and my husband is on Medicaid in a nursing home. My son is going to move in with me to help me financially. I will then sell my house and give him $100,000. Will this affect my SSI? Yeah, yeah. Yeah, I would talk to an estate planning attorney on that one. That's some because Medicaid is probably going to go after that money, and they're going to might be considering that you're hiding that money. So yeah, that you really need to talk to an estate planning attorney on that one. What a lot of people do is, we never know when this is going to happen, but if you've got a house like that, because if Medicare supplements and Medicare Advantage, original Part A and Part B and stuff like that doesn't cover, nursing home like this, those, however long they're going to be in a nursing home at the end of their life. So you have to pay it out of pocket, and you pay it out of pocket, and you pay it out of pocket until you don't have any pockets left. And then you can apply for Medicaid, and then Medicaid will pick up the tab. But if you had a house, then they can take that house. And some states are very, very rambunctious about taking houses. But if you get contact with an estate planning attorney and get an irrevocable trust 5 years before this event happens, then they can't touch your house. There's a 5-year look back. So that's what some people are doing. But talk to a estate planning attorney. I was trying to set up a network of estate planning attorneys, but I'm still working on that one. Do I have to finish my Advantage time before I get a Medicare supplement? Are you the one on disability? No. Once you hit 65, yeah. No, not necessarily. So reach out. So are you saying that if someone's okay, I already answered that one. Jumped around a little bit there. If I deferred taking Medicare because I am working and have coverage through my employer, will I need to go through medical underwriting and when I stop working? No. As you know, you can go ahead and you don't have to sign up for Part B when you're working. You have health insurance from work, and your employer has 20 or more employees. Your work or your spouse's work. And once you stop working and start receiving that health insurance, then you sign up for Part B. And once you get Part B, that's the trigger that you can go ahead and get whatever plan. So people that are 70, 75 years old just stopped working, they can get a Medicare supplement plan without any help underwriting because they're new to Medicare Part B. So if you need help, email me and I can have someone give you all your options. Is my pension from city job affect on me applying for Medicaid? Yeah, Medicaid is a welfare-based program. So if you're receiving, money from some other place, then Medicaid, your state Medicaid will look at that and determine whether you are in fact needy. If I was only married 4 years and blind and disability in Denver, and she died in 2000, have to be married second time. Could I increase my income by applying for her Social Security? So if you're only married 4 years, then yeah, you would have to been married. Sound it was the divorce. If you were married when that person passed, then you can eligible for survivor benefits. But if it was a divorce, you had to be married for 10 years. I received my husband's Social Security as a widow. Is there more out there? Yeah, you have to call up and get the PIA, primary insurance amount. Let's see. If I leave the US, do I still need to have the Medicare deducted even though I will not be in the US? Um, yeah, I mean, you can stop it, but if you ever start it again, then you're going to be penalized for the rest of your life. 10% for every 12 months you don't, they're not enrolled. And you can only enroll January, February, March during the general enrollment period. So I did a video on that, living overseas, and a lot of people are moving overseas and they say, "Well, I'm never coming back," and then 2 years later they come back and they don't have Medicare now, or they come back because they're sick, and so they have to wait 6 months or pay everything out of pocket until their Medicare starts, and then they pay a penalty for the rest of their life. So those are decisions that you definitely need to check out. I've been getting SSDI since 1999. And I don't remember getting one in the past. I got one. I received today. CDR says since. Okay, yeah, I'm not following that. Let's see here. Happy Father's Day, Dr. Ed. I'm listening to learn. This is a maze. Yes, it is a maze. Thank you. Thank you. Liz, does the Social Security office need to tell you if ex-spouse passed if you can prove 10 years of marriage and you have their Social Security number? Um, Yeah, usually you have to go through, you have to actually show that, you had that relationship, and, marriage documents, they're not going to just give out, information on someone. So you have to, give them the marriage certificate and the divorce decree for them to, and then they'll probably be, depending on the person, be a little cagey. But if they say, okay, let's go ahead and file survivor benefits claim for you, that means they're deceased. So, or if they say, yeah, there's not enough money because you can only get to 50%, that means that person is still alive. So the best way to do it is, call up Social Security and say, hey, I want to file a surviving spouse claim on my ex-husband. I heard he's unceremoniously passed away. And they'll say, no, you can't file a survivor's claim on that. And so that's your indication that either there's no more money there or that person is not deceased. Again, it really depends on who you talk to on the phone or at the office. Some, blurt out the information, but they're technically not supposed to, it's private information. I'm a retired federal employee who kept FEHB, federal employee health benefits. When I take Medicare A, do I need to purchase Part B? No, no, you can get it if you want or not. My friend's ex-husband lives in a different state and collects a big disability check. I told her she better check the obituaries often. Yeah, or just call Social Security every, month or 2 months and say, hey, I want to file a survivor's claim. And they'll say, yeah, no, no, no survivor's claim there yet. So what is survivor's benefits? His or her larger payment for Social Security? Yeah, it's when your spouse or ex-spouse that you've been married to for 10 years passes away. Widow benefits, widower benefits, survivor benefits, all the same thing. If I have remarried, do I lose right to survivor benefits on an ex-spouse? If you remarried before the age of 60, yes. Or if you remarried before the age of 60 and since divorced, then you're good. So again, there's another thing that millions and millions of dollars out there being lost because people say, well, I was married to someone for 10 years in my 20s and 30s, but I got remarried. I'm now divorced. So I guess I can't collect on my first spouse. That's incorrect. So another tens of millions of dollars out there being lost. Hello, I claim Social Security benefits on my deceased ex-spouse is 66. Can I claim my own benefits after 70 if they are higher? Yes, but not after 70. The max your benefit will go up is 70. You'll stay colon still. But yeah, you get your max delayed retirement credits at 70 years old. So yes, call up about a month or two before you hit your 70th birthday and say, hey, how much is benefits on my record now? And they'll tell you. And if there's more, then they'll tell you to go ahead and they'll schedule an appointment and file a claim and get you your money. If I'm on an overpayment plan now, how do I get it reduced? Now it's super simple. Call the 800 number and tell them you're in a payment plan and you want to take advantage of that new 60-month deal. And hopefully they can set you up with that 60-month deal and reduce your, you know, your payment every month. If your spouse has been deceased for over 9 years, is it possible to receive survivor benefit? Yeah, it doesn't matter. Yeah, if you're now 60 years old, if you're, your spouse that you were married to when he or she passed, and you were married for at least 9 months, exceptions exist. And then 40 years later, you've never gotten remarried, then yeah, as soon as you hit 60, you can do it. Are there any plans that pay for nursing home? Yeah, there was the long-term care insurance that was popular quite a few years ago, but it just if you sign up for long-term care insurance in your 40s, it's reasonable, but most people don't want to do it in their 40s. But if you wait until you're late 50s and 60s, it's just crazy expensive. So long-term care insurance used to be a thing, but not so much anymore, unfortunately. Yeah, they really need to come up with something. All right, I'm over an hour, so let's do one or two more questions from people that I don't think have ever asked a question. Auntie Ree, I don't know. I'm 59 this year and on SSDI. My ex turned 60 this year. When is the best time to look into IEDS? When your ex turns 62. Independently entitled divorced spouse. But great that you know about that now. So, but they have to be 62. I collect Social Security at 62. My husband collected at 65. If he was the past, do I get 100%? If you're your full retirement age, he collected at 62. Yeah. So there's it's called a widow's cap, a widow's limb, rib limb. So because they filed early, yours is reduced. You don't get 100% of their primary insurance amount. You essentially get 100 up to 100% of their benefit amount. So, all right, last one here. What is the impact of not taking Medicare Part B because I have FEH? Well, I have no. The federal government doesn't. If you're a federal employee, the federal employee health benefits plan doesn't demand you get Part A and Part B unless you're in the Postal Service. They just changed that, but yeah, they don't mandate that as of now. All right, that'll do it for today. If I didn't get to your question, I will be back again live tomorrow. Y'all have a great